Elder abuse is defined as any type of mistreatment concerning those 60 years or older. It is often committed by a family member, a caregiver, or someone the elderly trusts. This form of abuse is becoming more common in recent years compared to other types of abuse. There are 6 categories of elderly abuse: physical, sexual, mental and psychological, neglect, abandonment, and financial abuse. Physical abuse involves the use of physical force and can lead to serious injuries or even death. Sexual abuse towards the elderly is any sexual act without consent. Mental and psychological abuse involves any harmful action that affects the mental or psychological aspect of the elderly. This may also include the use of a loud or threatening voice or the use of improper language. Neglect is the failure to meet the basic needs of those who are elderly. Abandonment is when anyone leaves the elderly without anyone to care for them. Financial abuse is the theft or misuse of assets, money, or property. The scope of the problem is that the elderly should be treated just like any other individual. It is unjustifiable that anyone should be mistreated due to their age, yet elderly maltreatment is increasing and happens more often than one would suspect. Adding to this problem is that many of the elderly do not speak up for fear of their well-being and damage to their reputation. Some statistics on elder abuse include about 1 in every 10 older persons is abused per month. Of those, only 1 in 24 cases is actually reported. Those that have been mistreated have a 300 times greater risk of death. The population of those who are elderly will double from 900 million in 2015 to 2 billion in 2050. What are the impacts upon health? Elder maltreatment can bring about serious problems. The elderly are fragile, and many injuries can lead to serious bruising, minor and major cuts, and broken bones. Depending on the health condition of the elderly and the seriousness of the harm, these injuries may even cause premature death. Risk factors for elder abuse include being older than 60 years of age, having poor mental and/or physical health, and their gender. Family members and caregivers are usually the perpetrators, and risk factors for them include alcohol and drug abuse, financial dependence of the perpetrator, mental illness, lack of training of those who work with the elderly, and depression. Prevention of elderly maltreatment must include public and professional awareness campaigns, better alliances being formed with our senior citizens, law enforcement and protective services, and encouragement of all seniors to report this type of abuse. We must educate family members and caregivers by offering prevention programs and counseling, and also establish safe houses and shelters for victims. To report any suspected case of elder abuse or neglect in the Worcester area, call Elder Care Protective Services at 1-800-922-2275.